Thank you, Mary. We'll get started. Good morning, all. So glad to see everyone, and so glad everyone could join us this morning because we're here to talk about Southside transformation. And I want to let you know that this session is being recorded because there are so many people who may have wanted to join but could not join us at this time. My name is Rashard Johnson. I have the privilege to serve as the president of Advocate Trinity Hospital as well as Advocate South Suburban Hospital. And I'm honored to share with you that I'm the newly elected chair of the board of directors of our newly formed non-for-profit organization, the Southside Healthy Community Organization. So excited to share this news with you that the Southside Healthy Community Organization, or SSHCO, as we so passionately refer to it, is an officially incorporated organization as of late September, dedicated to the health transformation on the South Side of Chicago. This is followed by the tremendous news this summer that the Illinois Department of Healthcare and Family Services planned to set up in a big way millions of dollars to fund support of transformation of health, not only in our community, but in several communities across the state. And so now our dream that we've talked about, we've discussed, the dream that we've so longed for is now a reality. Honestly, I want to say we all have to give ourselves a big round of applause to everyone on this call. So thank you for making that happen. Since we've made the announcement just in July about the state funding, we've learned that the state of Illinois specifically set aside $26 million for the Southside transformation in the first year to support our critically needed plans. As so long as we're able to meet the criteria, which we will, and the milestones that we set as far as our vision and our promise to the state, we foresee and we're eligible for continued funding over the next 5 years. Since the state news, we've been very busy, as you can imagine, and as you would expect, behind the scenes, putting the necessary infrastructure together to stand up a plan for our new organization that will conduct the necessary work that we intend to make a huge difference and we know will make a tangible impact in ultimately transforming healthcare and building much healthier communities and improve outcomes and access on the South Side. So you may recall some of the key issues that were brought up through extensive community research and outreach. There were a number of town halls, a number of surveys that many of you, if not all of you, participated in, and you gave us feedback that we asked for. You told us things like having more physicians within our community, physicians that reflect our community is extremely important. Having a focus on social determinants of health, the lack of ease of access to nutritious food or transportation in between our clinic visits to keep people safe, affordable housing, things of that nature. Having more educational sources in the community for things like better health, things like healthcare chronic diseases, being educated about some of those issues that plague us in our community is extremely important. And having an enhanced care coordination system between our clinics and our hospitals, our community-based organizations, in order to bridge those gaps of systems to provide a better care and provide better decision-making was important. You also mentioned access to specialists, especially mental health care services, as well as OB and maternal health services, and chronic disease management will be extremely critical to building a healthier community, and so much more. We took all of that advice into building our model of transformation, and it's great input, and we intend to share that with you today. And it's our hope and our belief that together collectively, we can make an impact on our community that we're all seeking. And now we're going to take the time, but along the way, we also promise to keep you very transparent because this will take some time as we work through this model. So we'll provide a lot of communication, details behind our plans, and just updates around how we're doing and how we're progressing. Before I turn this over to the speakers on the agenda, I also want to note that we want to hear from you this morning. Your input, as was before, is critical now. And so we will open it up for a Q&A session for about the last 15 minutes of our town hall. So if you can please direct your questions to Laura Markin, you should be able to see her on the Zoom chat, and she'll compile those questions and we'll answer them promptly. So next we'll go through our agenda. You'll hear from Kimberly McCullough-Starks, who's the Deputy Director for Community Health Outreach for the Illinois Department of Healthcare and Family Services. She'll talk big picture with you about the state's healthcare transformation collaboratives and also why transformation is important for us, as well as a little bit about our project. And then we'll hear from the rest of our speakers, who I am so privileged and honored to serve with as board of directors for our newly Southside Healthcare community organization. Barrett Hatches will speak first. He's our president and CEO of Chicago Health and Family Services Center. And Barrett is also the vice chair of the SSHCO board. So he'll share with you about our model that I just talked about briefly, but he'll talk about our work and our status and what our expectations are moving forward. Veronica Clark, she's president and CEO of TCA Health. She'll talk about our SSHCO board, who's on it, and how will it work. Then Diane Sinclair, our Vice President of Organizational and Community Development for St. Bernard Hospital. She'll introduce you to 3 of our community-based board members who are critical to our work that we aspire to accomplish. Then we'll go to Krista Hamilton, who is the new President and CEO of UCAN Chicago. She'll share some preliminary thoughts on the Community Advisory Council. We're hoping to build as an important way of continuing to receive feedback from our community voices front and center about all the work and the jobs that we plan to create, because creation of jobs is extremely important to building a healthier community. And finally, but importantly, Cecile Demello, another very active community leader in this process, and she currently heads up the teamwork. Inglewood will lead us in a question and answer session about what it will take, and putting in the chat along with what it will take for all of us along the way to aspire to transform our healthcare. So lots to share. We hope to hear from you with this chat as well. Remember to direct your questions to Laura Markin, please. And I'd be remiss if I didn't acknowledge our elected leaders, our federal, state, and local. They've been tremendously supportive and engaged in this process from the very beginning. We thank you from the bottom of our hearts to this very day. Your leadership is so critical and so grateful to have. We would not be here today without the support of our state legislators, that of our governor, who authorized the funding for healthcare transformation in all of Illinois. So a special thanks to the Illinois Healthcare and Family Services Director, Teresa Eggleston, and Deputy Director, Kimberly McCullough-Starks, for their tireless and relentless efforts to transform healthcare in the state of Illinois. And without further ado, I'll turn it over to Kim.
So thank you so much, Rashid. Really appreciate the opportunity to join this group this morning to talk about healthcare transformation. First of all, as we were thinking about healthcare transformation, we looked all around the country, to look for a definition of healthcare transformation. We've been on this journey for several years. What we found is we didn't find a definition. So we decided to define it for ourselves and what healthcare transformation means to us. It's a person-centered, integrated, equitable, and dramatic change in the delivery of healthcare at the community level. I'm so proud of Illinois for charting this path forward. I'm also proud of the work of each and every one of your organizations, and for everything that you're already doing to address the social and structural determinants of health. We want to align our collective efforts and keep our focus squarely on the individual needs of customers and why they need the services that they need, what they're telling us that they need, and what they need in their communities. Throughout this journey, we talked and listened to many, many interested parties and stakeholders, each with their own ideas, of course. And we made it a point to listen to actual customers, to hear directly from them what they needed. And so many times they told us big healthcare providers and big businesses come together and tell us what they're going to do to us instead of working with us to come up with solutions. They said that we need you to hear from us what we need and how we can capitalize on and grow the resources within our own communities. Such a simple and powerful statement. We really listen to our customers, and to that end, I would like for you to go to the next slide. We also included in this journey the notion of advancing racial equity. It's actually a key focus of healthcare transformation. HFS has made clear why racial equity is important to our work. The HTC initiative was specifically designed to place racial equity at the center because providing opportunities to invest in catalyzing structural solutions to the system, to systemic problems, is an important aspect of what we want to see in terms of change. This is done through aligning resources to support and drive equity-centric transformational projects. In order to move the dial on racial equity, the Department of Healthcare and Family Services has embedded a racial equity tool into the application process to assess how proposers seek to advance racial equity and actively reduce and prevent racial discrimination and inequities. This tool centers racial equity, in terms of prompting applicants to unpack decision-making points through a lens of racial equity by showcasing how the proposed plan centers and will contribute to advancing equitable health outcomes. Next slide, please. So let's talk about why Healthcare Transformation Collaborative. Healthcare Transformation Collaborative was really designed to address the status quo. The status quo is not bringing the results that people want or deserve. What we all know is that it's just really not working. And it's not working due to a variety of complex reasons. The net result is that we are seeing persistent negative health outcomes, particularly in socially vulnerable communities. Next slide. What we know for sure, and this is based on a study by the Robert Woods Johnson Foundation, is that the social determinants of health account for 50% of health outcomes. And we all have full-time jobs and really can't create the change we want off the corner of our desk. We wanted to create a new program with real incentives to focus beyond the core mission and work together towards better outcomes and more holistic care for people. Next slide. People's health needs cannot be addressed by healthcare systems alone. The facts are clear. People's health needs, need to be addressed by the social needs, and it has to be in concert with physical and mental health, and this care needs to be available in people's communities, which is why we felt it was very important to have input from the community in terms of what these projects would look like. Next slide. So when you think about the integration of care, HFS, as it relates to trying to address the status quo, was seeking to fund healthcare transformation collaboratives by looking for applicants that included community input, that were data-driven, that really were meeting the needs of communities. These collaborations were, thought to consist of physical and behavioral healthcare providers working together with community organizations that provide for social determinants of health in order to care for people holistically. Next slide. So why the Southside Healthcare Transformation? This project was unique in that the collaboration was driven by community input and dedicated to fundamentally addressing healthcare access and better health outcomes for Chicago Southside residents. So you see on this slide, there is a word cloud, and these are some of the things that we heard from our customers as we embarked on a study that was conducted by the University of Illinois at Chicago's Center for Health Innovation. What we heard is that people, as Rashid alluded to earlier in this morning's discussion, wanted to address things related to mental health, related to depression and diabetes management, hypertension, if you will, a myriad of different challenges that people were facing, and they were looking for integrated care, if you will. And so we were excited to see this proposal from the South Side of Chicago that was specifically focused on all of these areas and bringing together a vast group of provider organizations and community-based entities working together in order to meet the needs and address the challenges of the community. I am grateful for the opportunity to speak with you today. Just know that HFS will be monitoring this project along the way. We are looking forward to working collaboratively with the South Side of Chicago in order to make sure that these services are being stood up in a meaningful way. I would now like to introduce our next speaker, Mr. Barrett Hatches. And with that, Mr. Hatches.
Thank you so much, Kim, and thank you so much for your leadership in this transformation process. Good morning to everyone, and thank you all for being a part of this and from the beginning. As Rashad talked about earlier, I just want to share with you a couple of things that we've been doing since we were made aware in July that we were awarded this transformation grant. Our 13 hospitals, health systems, and our FQHCs have been working really hard together on many items that are critically needed for foundation elements to support this model. So one of the things we've done, we filed articles of incorporation for this organization. It's going to be a 501c3. We've started implementation teams across our 13 member organizations around healthcare delivery, social services, and technology. We've started at 8 work streams as a result of this. And so we've done some of the basic things that you can imagine that are necessary to support a business model like this. We began the identification to launch a CEO search. We're determining that we'd like to try to get this started, but maybe in a couple months with a potential hire by early spring. We've also formed a board of directors, which you're going to hear a little bit more about later. But our board of directors are working really close with the Illinois Department of Healthcare and Family Services to ensure that we're meeting the deliverables we set out to achieve. Next slide. So what you see in front of you here is our service area, and this is all on the south side of Chicago.
So much to the extent that it became one of those things that my mom liked, I think, just as much as like having it around just as much as my brother did.
Please.
So what you see on the left side of the zip codes that are served by this collaboration. And on the right side, our 13 participating organizations where we're located and across the south side. Next slide. Let's talk a little bit about the model. There are 4 key areas that we're focusing on. One, adding new doctors to the south side. We're going to be hiring new primary care docs that will all be located in our clinics on the south side of Chicago. This is going to give greater access to care, but it'll also serve to help shorten the wait time to get appointments. Number 2, we're helping people both manage their illness and prevent them. So as part of the health and community organization, our hospital partners will be hiring specialists. Now, these specialists will be doctors who will focus on patients with more complex needs. And third, we'll make it easier for the community to access care. We're going to try to make doctor's appointments, finding resources in the community, and working through insurance can sometimes be very difficult. So our health community organization understands that we need to hire staff to support patients through this process. And number 4, developing extensive technology that will connect all of us throughout the South Side to support continuity of care for our community. Our 13 collaborating partners will be much more effective at reaching patients when we're all able to communicate with one another. And so technology is going to allow us to do that. So we're developing a technology platform that will help all of us work together as a system and provide convenience to our patients. Next slide. Let's talk about the milestones. These are the things that are really, really important. The things that we said we were going to do in year 1. We're going to hire 15 primary care and OB providers. Again, these docs will all be focused on Southside healthcare. These doctors will be placed at our clinics on the South Side, so it will expand the services that we already are offering and will give greater access to care. We're going to hire 7 specialists. Again, as I talked earlier, these specialists are doctors that treat conditions that last a long time or are very complicated. More long-term care is needed. Our hospital partners will hire these specialists as part of the model, and we will get access to those specialists through our hospital partners. Next, we're going to hire 80 community health workers. These are care coordinators or social workers These care coordinators' role is to help patients with those, what we call those hard to do tasks, like scheduling an appointment, finding and connecting to resources, and in some cases, follow up directly with patients in their homes. And 4, small scale technology functionality. Again, as you know, technology takes a long time to source and to develop. So in year 1, we hope to have some connectivity between our systems to support communications. And over time, we'll be able to build upon that and put in place a larger and more comprehensive technology platform. So the Illinois Department of Healthcare and Family Services is tracking 4 metrics across all the healthcare transformation sites. And 1 is providing access to preventative healthcare, 2, controlling patients' high blood pressure, 3, ensuring patients connect with follow-up care after mental illness episodes, and 4, ensuring patients are connected with follow-up care after coming to the hospital for alcohol and substance abuse. Now, in addition to these items, we also are accountable in areas that we know from meeting with you over the last year or so, and through our proposal development, are important to this model. And so some of those things are diversity in our hires, provide us with culturally competency training, and establishing a community advisory committee. So these are process measures that are vitally important to the sustainability of the model and to its relevancy to the communities we serve. And I want to say we've got our eyes on the ball. We've been doing a lot of work behind the scenes, as Rod talked about earlier. And now I'd like to turn it over to Veronica Clark, who will share more about the board and its role in this exciting work.
Good morning to you all. I'm so happy to be with each of you today. My name is Veronica Clark, and I'm the president and CEO at TCA Health Center, another federally qualified health center in Chicago's South Side, and a board member of the South Side Healthy Community Organization. I'd like to spend a few minutes introducing you to the board of directors of the South Side Healthy Community Organization and their roles moving forward. So, sorry, just want to make sure. I thought I was muted there for a minute. Our board is comprised of 1 leader from each of the hospitals, health system, and federally qualified health center who have joined together on this important health transformation initiative, plus 3 members of the community and whomever will be our CEO. That means our board has 17 members, and members are typically president or CEO of their organization or the senior person most heavily engaged in health transformation initiative. You could see them on this slide, but I'll briefly list each of them. Starting with Bernita Backus. She's the CEO of Friend Health, a federally qualified health center on Chicago's South Side. Brenda Battle, Senior Vice President and Community Health Transformation and Chief Diversity, Equity, and Inclusion Officer at University of Chicago Medicine. Kenneth Burnett, he's the CEO of Kristen Community Health Center. Myself, Cecile Demello, CEO of Teamwork Inglewood. We have Dr. William Dorsey, CEO of Jackson Park Hospital. Tim Egan, the president and CEO of Roseland, the new Roseland Community Hospital. And we have Krista Hamilton, president of UCAN. We have Barrett Hatches, who you just heard from. He's the CEO of Chicago Family Health Center. Margie Johnson, CEO of Beloved Community Health Center. Rashad Johnson, who is president and CEO of Advocate Trinity Hospital. And we have Bernice Mills Thomas, and she is the executive director of Near North Health Center. We have the Dr. Reverend Otis Moss from Trinity United Church of Christ. We have Leslie Rogers, and he's assistant administrator of South Shore Hospital. We have Dionne Sinclair, Vice President of Organization and Community Development of St. Bernard Hospital. Dr. Erica Steed, she's the Executive Vice President and Chief Operation Officer of Sinai and Holy Cross Hospital, and an open spot which will be filled with our new CEO. So our 3 community leader board members were selected from a pool of recommendations of community leaders who have been heavily engaged in our health transformation work from the beginning. The board's role is to provide oversight and direction for development of the Healthy Community Organization, approve strategic plan, and hold the management team accountable for implementing it, approve funding for various initiatives, approve our annual budget and our operating plan, and hire the CEO, of course. So earlier on, our board has been meeting weekly to keep things moving as we build infrastructure and make any number of early necessary decisions around a whole host of issues when you're standing up a completely new organization. As our new President Rashad said, a board chair, which is our board chair, he mentioned earlier that all of this takes time to do and to do it right. Therefore, hence the meeting every week. I imagine down the road that we will be meeting more like monthly, but for now, weekly is needed. I'm sure my colleagues are tired, but they're relentless and they're committed. So we'll continue to do whatever it takes to make this happen. To get to know our community board members a little bit more, I want to introduce you to Dionne Sinclair from St. Bernard Hospital.
Thank you,
Diane.
Veronica. Good morning, everyone. My name is Dionne Sinclair, and I am the Vice President of Organizational and Community Development, and also a board member of the newly formed Southside Healthy Community Organization. I'm with St. Bernard Hospital, my apologies. This collaborative has really prided itself in ensuring that the voice and the perspectives of our community residents is the focal point of everything that we do. And to that end, we invited local leaders, strong community leaders, to be part of our board of directors so that the voice of the community would be informing a lot of the decisions that we make. So I want to take a few minutes to talk about 3 outstanding community leaders who are now part of our board of directors. These community board members are passionate, they're committed to communities, and they are focused on making sure that health equity is always at the center of the care that's provided on the south side of Chicago. So I would start with Cecile Demello. Cecile is a community organizer, a community developer, and a policymaker that has a history of working to uplift communities on the south and west side of Chicago. She's currently the executive director of Teamwork Englewood, which seeks to improve the quality of life of the residents and stakeholders of the Englewood community. She was previously the co-executive director of Blocks Together for 10 years, and that responded to the need of the West Humboldt Park and Garfield Park communities by focusing on community health. In addition to her role as executive director, Cecile also serves as project manager for the Englewood Quality of Life Plan at Teamwork Englewood, and has been very active with our Southside Health Collaborative since day one. Cecile lives and works in Englewood community. So for her, this is more than just work, it's personal. And she will be instrumental in all of our efforts. Our next community board member that I want to talk about is Krista Hamilton. Krista Hamilton, a well-known community organizer and the current CEO and president of UCAN. And I need to mention that she's not only the first woman, but also the first Black CEO in the organization's 152 history. UCAN builds up youth and families through compassionate healing, education, and empowerment. This is an exciting new position for Krista, who was most recently CEO and executive director of Centers for New Horizon for over 10 years. That is a not-for-profit organization with locations across the Chicago South Side that assists children, youth, and families in becoming self-reliant, improving the quality of their lives. And she has contributed her expertise on boards of directors in numerous organizations. She currently serves on the board of Chicago Citywide Literacy Coalition that helps adult education organizations secure resources and training. Krista is an innovative, goal-driven, and progressive leader. She has been described as a star in the social service sphere, and we're looking forward to her leadership on the board, and you will hear from Krista later. Our third community board member is Reverend Dr. Otis Moss III. He is the senior pastor of Trinity United Methodist Church, which is one of the largest faith institutions in Chicago. He is a preacher, poet, activist, author, and an award-winning filmmaker with an eye towards justice and equity. Reverend Moss founded the Unashamed Media Group, a justice-centered, faith-based agency committed to producing and curating stories to inspire the hearts and challenge the mind. Reverend Moss has built his ministry on community advancement and social justice activism, but he is also widely known for his leadership, improving the health outcomes in Black community for the past 2 decades. So as I get ready to turn this over to Krista Hamilton, one of our community board members, I encourage all of you to continue sharing your ideas and thoughts with our community members, board members, and with the rest of us, so that your voice continues to inform and be the center of the work that we plan to do through this organization for healthcare transformation. Now, Krista will talk to you about our commitment to minority vendor participation and hiring and how to remain engaged. Krista, over to you.
Thank you, Diane. Good morning, everyone. As noted, I am the new president of UCAN. I think I am at my 62nd day now. Really excited to be here. I have lived and worked on the Chicago South Side for my entire life, and I'm a proud member of the SSHCO board. I have a few updates I want to share on community engagement and ways to stay or get involved going forward. I know one very important aspect of the development of HCO to everyone on this call is how can the community continue to stay engaged, as you all have been with us throughout this entire process. We have a few ways for folks to plug in to the new organization. First, we want to let you know that we are committed to partner with vendors from the South Side, and in particular, MWBE or BEP certified companies. As part of our funding agreement with the Healthcare and Family Services Department, the HCO committed to spending at least 36% of operating dollars on minority-owned businesses, as well as at least 7% specifically on women-owned businesses or women-managed controlled non-for-profits. Examples of these purchase services and funding subsidies will include community-based social services, education, training services, contracted care coordination, and transportation services. As we work to develop requests for proposals or RFPs and seek out partnerships in these areas, members of our growing listserv, everyone on this call, and folks who have already reached out with interest will be the first to know. We are excited to partner with you very soon. The second way to connect with the HCO will be, we will create a significant number of jobs for Southside residents. HCO is all in and is targeting to hire approximately 400 staff, including community health workers, physicians, advanced practice providers, nurses, administrative staff, and other positions. We will focus on hiring processes that ensure racial equity from recruitment through retention and professional development opportunities. We commit to at least 30% of the new hires being residents of the South Side of Chicago. The last but not least, we are developing a community advisory council. So the Community Advisory Council is a formal group of community members who will meet regularly with our new CEO and the board of directors to provide input and feedback. We will be looking for about 20 members, which will be diverse across a number of factors, reflecting the breadth of experiences of our community. We hope to work with our new CEO very soon to start selecting candidates by spring. We will be honored to have your feedback and input on the council. So coming soon, there are going to be 3 ways to connect with the SSHCO: partnerships, jobs, and community advisory council. But outside of the formal channels, we still want to keep everyone involved and engaged. We would really like to hear from you. How would you like to stay involved or connected to the HCO? That's what we want to know. So right now, we're going to launch a virtual poll so you should see it pop up on your screen very soon. And you're going to take a couple of minutes just to let us know, how do you want to be involved and stay connected? And we're going to please select your top 2 choices. So go ahead and click on, and then we'll be able to see the answers together right away. And if you have some other ideas that are not listed on the poll, feel free to put them in the chat. Okay, we're almost at 100% participation. It looks like town halls, like this one, is leading the pack. Okay, so with 80% participation, I think we can all agree that we want more town halls like this one. I think we've been doing a really good job with the town halls, so we'd love to continue those. Email updates, I think those are amazing as well. There's a couple other strong third and fourth options. So we'll keep all of those in mind as we move forward. We also have started a Facebook page. So, feel free to go on today and like us, the SSHCO Facebook page. There we're going to share content, updates, and you can share with your friends and your other networks as much as possible. So thank you for your participation today. I know you've heard a lot of information. We're going to move on to our Q&A session led by my colleague, Cecile Demello.
Good morning, everyone. As Krista mentioned, my name is Cecile Demello. I'm the Executive Director of Teamwork Inglewood. I'm so honored to be here to help answer some of the questions that the community may have. We've been hearing a lot of questions from all of you. We want to make sure that we answer as many as possible during the town hall. So I'm going to start answering a few pressing questions that came in, and I'll pose a few questions to some of my fellow board members. Anything we're unable to address today in our town hall, we'll be sure to answer through our website at a later date. So here's our first question. What can the community expect between now and the first quarter of 2022, which is around the corner? Right now, we are working to finalize our funding agreement with the state. This agreement would allow us to access our funding to implement parts of this work. One major administrative priority is hiring our CEO. We are also working really hard on refining and continuing to develop our care model and building out the infrastructure and the details of how our organizations work collaboratively together toward our goals. And we will also be developing a community engagement strategy, which I'm very excited about, in part based on feedback from today's meeting and the feedback we got as we began the convening of community partners earlier in the process. All right, our second question. When will the community start to see and feel any changes in healthcare access and delivery? Very good question. As we start to hire and employ more people into various caregiving roles, there will be more support and access to healthcare resources for patients on the South Side. Community members will see an impact as we are able to serve more patients through the evolution of our model. We anticipate a lot of hiring to begin in the summer of 2022. Here's another question. Where are you in the process of hiring or appointing the CEO of the organization? Very good question. We engaged an executive search firm to support us. Exeter Group, a BEP certified Chicago-based executive search firm, will be helping us with this. We recently finalized the position requirements in our weekly meetings and are about to begin stakeholder interviews to make sure we are adequately capturing the objectives of this role. We are targeting late winter or early spring to onboard someone on this role to help us begin implementation. I have a question that I'm going to ask Kimberly from HFS to answer. Kimberly, one of our participants would like to know, can you share the equity tool?
Sure. The equity tool is actually available on our website. So if you go to the HFS HTC website, you'll actually find the tool. We can definitely share it. If you want to add your email address to the chat, I would be more than willing to send you the tool directly. It was created by the Robert Woods Johnson Foundation. It is a tool that is being used nationally, and it's the first time that we've used such a tool here in the state of Illinois. And so we're welcoming feedback related to the tool, and we found that it was very helpful for us during the first round of HTC funding, and it is incorporated in the application in the current round of funding that is open, which will close, by the way, on November the 19th. I want to put in a shameless plug that the application period for the next round of healthcare transformation funding is now live, and we are accepting applications until 7 p.m. on November the 19th. Thank you.
Thank you, Kimberly. Here is another question. I'm going to ask Barrett if you can answer this question for us on this town hall. How will you establish continuity of care for the community? Got to go off of mute. There you go.
There we go. There we go. Our model includes three main things that will help with continuity of care. One, a care team that works across multiple locations. Two, a technology platform that will allow different sites to communicate. And three, a close connections and referrals with community-based partners, referrals, and case management. And we believe that having all 13 collaborative partners all working together with care teams, technology, and social services, that our patient will be better served.
Thank you. I have another question, Barrett, that I think you can answer as well. What are the success measures for this project?
HFS, our funding agency, is going to be tracking 4 key metrics to assess our success. One will be access to preventative care. 2 will be reducing high blood pressure. 3, follow-up post-discharge from mental illness. And 4, follow-up post-ED visits for substance and substance abuse disorder.
And here's a follow-up question to that. What will be some of the areas of focus?
There are going to be 4 areas of focus, primarily that I mentioned a little bit earlier, but one will be a focus on patients with high blood pressure. A second focus will be patients in need of preventative care. Here's another big one here, patients who are pregnant, and 4 patients with behavioral health needs. Those will be focus areas.
And then here's one more for you. Do you know yet how much money SSHTP will receive from the state?
Yes, yes. We're happy to say that in year 1, we will receive $26 million. And as Rashad said earlier, based on performance and outcome, we expect year 2 through 4 to receive $30 million annually.
Thank you. I have a question about the actual organization. I think I'm going to give this to Rashad. Rashad, what is the status of the new Southside Healthy Community Organization? And a follow-up question to that is it incorporated?
Yeah, we get this question often. So we are extremely proud to announce that we filed our articles of incorporation in September. And so the next step for us will be to file our 501c3 status, which we're working on now. And we hope to have this done within the next several months.
Thank you. Here's another follow-up question around that. Have you hired any members of the community for anything, or have you made any vendor decisions already that have a positive community impact?
Yeah, as you can imagine, with the extensive work that we have ahead of us, we've contracted with a few firms to support our implementation efforts and roll out, and we've prioritized the BEP certified firms in particular from our community. And that's based on our commitment, to be honest with you, as we receive funds from the state, our commitment is at least 36%, of our operating spend to be within this area.
Here's another question around hiring for you as well. When will community health workers start to get hired? I'm excited about this one.
Yeah, well, I think we're all excited about this one, as this is a key and critical part, the key component of our model. And so we anticipate to start our clinical hiring around the summer of 2022.
Awesome. And one thing about the introduction of myself, I live in Inglewood, I work in Inglewood, but I also use the services on the South Side in Inglewood. So here's a good question that came in. When will more physicians be hired and accessible to the community?
Another vital component, and we've heard this from our community based off all the feedback. And so this aligns with our community healthcare workers, whereas we anticipate starting to hire these clinical roles of our physicians as well in the summer of 2022. So big summer ahead for us.
Yes, I have a few more questions, and I'm writing more questions that are coming down in the chat. Can you share any details about the Community Advisory Council, Rashad?
Sure. So our Community Advisory Council, we anticipate it's going to include about 20 community members, and definitely from diverse areas of expertise, reflecting the breadth and depth of experiences within our community. And we anticipate starting to select these candidates by next spring. So a very vital part of our structure.
Awesome. And you talked about the community advisory's role specifically.
Yeah, and what we look at this role to as a formal group of leaders. So this Community Advisory Council will meet regularly with the CEO as well as the board of directors to provide input and provide feedback, and really to keep our feet, and our finger on the pulse of the community and what's going on.
Thank you. So I know Laura and myself are documenting more of the questions that are coming in the chat. Just a reminder too, we will answer some of these questions on the website and probably follow-up conversations like formats like this with the town hall. So thank you, and these are really good questions. We just couldn't get to all of them. Rashad, did you have some additional statements you wanted to share?
Thank you, Cecile. Just to close us out, just want to thank everyone again for taking the time to join us this morning. As Cecile mentioned, any questions that were posed in the chat that we didn't get to this morning, we will certainly follow up with those in a follow-up email to all. So please go to our website that's listed here on the page. And we ask that you like and friend our Facebook page and share this information and these sources with your network and your Southside friends. So we promise to keep you posted as we have more information to share in full transparency. We want to thank you sincerely for taking the time, and thank you for being a part of our transformative efforts. We ask that you have a great day and enjoy the rest of your week. Take care.